Hi, I'm Dr. Christopher Crawford. I'm a general and bariatric surgeon with Meridian Surgical Group, and we do bariatric surgery at the St. Vincent Carmel Hospital. And I wanted to make a video today talking about what a diet would look like after bariatric surgery. There are a lot of questions. People want to know what kinds of foods they can eat, how big of a portion they can have, how it might be prepared. So I thought I'd make a video to talk through what that is. I have a big spread here today, and I'll look at some individual items. But the first thing I want to mention is that we don't weigh foods and we don't look at counting calories. The reason why is that with bariatric surgery, the size of the stomach is decreased. It doesn't matter which procedure you have, a gastric sleeve, a gastric bypass, the Roux-en-Y, or even something like a duodenal switch, the stomach is decreased in size and it physically can't hold as much as it could before. So the volume that you're putting in is what is an important factor to consider in whether or not someone will feel full and if they've gotten enough to eat. The other main thing that we focus on is protein, because protein is necessary for building blocks for a lot of different normal body functions. So we want to make sure that people get protein in. What we do try to avoid is added sugars, added fats, sauces, things like a lot of restaurant foods will have added sauces that really increase the calories without adding any nutritional value. And they also don't really fill you up that much, so it's easy to add on a lot of calories without necessarily feeling any more full. Over here, we have all the fresh vegetables. We've got, say, frozen beans. We've got, bell peppers, carrots, cauliflower, broccoli. In the early stages, you would definitely want to have these things steamed, boiled, finely chopped, and we'll talk about what those stages are. But we do want people to start getting in vegetables early after surgery. Here in more the fruit category, we have cherry tomatoes, apples, applesauce. This is something that people would be able to start eating right away after surgery. Berries, cutie oranges, bananas. In the middle, we're focusing on the starches. These are whole wheat tortillas. This is something you'd add later on, but is still a good choice. We have oatmeal. We've got a Chex type cereal, rice cereal here. These are sweet potatoes. You would obviously want to cut these into much smaller pieces, but these have a lot of vitamins and other good nutritional value, fiber in them, and they can be cubed, they can be mashed, roasted, you can spice them. Here I've got some brown rice. There's some added quinoa in here, which is more of a protein, but these came as a combo. And then there are some whole grain brown rice combinations. Here we have all of the proteins. Dairy is an important part of a lot of people's protein source after bariatric surgery. 1% and 2% milk are okay. Here you've got a large pork tenderloin. These are delicious. I love eating these. You can buy pre-grilled chicken meats. This could be something that you would add into a salad, eat on its own. Cheese, string cheese, one of my favorites. I'm from Wisconsin after all. Tuna, this would be the sort of thing that you don't want to be too dry, especially if you're right after surgery, because it'll stick and it's going to feel like you just took something and it's not going to want to pass through. So mixing it with like a light mayonnaise is a good choice. Greek yogurts, some of them have added sugars. This one does not have any added sugar. It has fruits in it that can be mixed right in. Beans, refried beans. This is a little tiny tuna packet as well. Cottage cheese, eggs, scrambled eggs early on. I have some sample meals laid out here, but the first thing I want to emphasize is every program is different and every program has a lot of information that they provide. The program at the St. Vincent Bariatric Center has a package of sheets that everybody refers to, and you should look at those things. Whatever program you have, look at your handouts, your sheets, trust what the dietitians are telling you, and this is meant to be a reference. Everybody has a slightly different situation. Every program advances things at a little bit of a different phase, but I just wanted to give some general ideas. So in weeks 1 through 4 after surgery, the main focus is getting in fluids. A minimum of 32 ounces or a liter is what people typically need in order to not get dehydrated. More than that is the eventual goal, but that's kind of the bare minimum. The food in the early stages is meant for taste, variety, make it so you're not just drinking water and protein shakes every day, but it's not the main focus in order to get in any type of goal for calories. And we do have eventual protein goals. It's usually 1 milligram per kilogram for an adult's ideal body weight, but that's also just a general number as well. So here's a sample meal that somebody might have after bariatric surgery in weeks 1 through 4. You want to have protein with every meal. This is scrambled eggs. This is 1 ounce or 2 scooped tablespoons. Here's a tablespoon, 15 milliliters. 2 of them would be 30 milliliters or 1 ounce. Here's some banana, soft food for both of these. These are good choices. For some flavor, things like salt, cinnamon, pepper, these are all acceptable things. They're not too spicy, shouldn't really irritate someone's stomach as they're recovering right after having surgery. Here's another sample meal. Now, I didn't boil this or steam it. Please don't eat raw vegetables right after bariatric surgery, or this sort of thing is going to get stuck. I have actually fished out a chunk of intact broccoli from somebody who went to a buffet once. So these things need to be boiled, steamed, and then I recommend chopped fairly finely. But here's a vegetable idea, and this is about 1 ounce. Here's some grilled chicken breast. You want to make sure that this is pretty moist. Brown meat might be a good, dark meat might be a good choice from like a chicken thigh rather than a chicken breast. But you could do either, just make sure it's not real dry. I've got an example here. This is tuna. This is after all the water's been squeezed out and nothing's been added. This is going to be really dry, and this is going to stick right when it gets here, if it even makes it past the top of your throat. So here I've added in some light mayo. This makes it much softer, easier to scoop, pour, eat. So I would definitely recommend adding those things. Here's some other choices. This is a starch. This is some oatmeal. This is several ounces here, so make sure you scoop, measure, and get an idea of what you're eating. Applesauce. This is a fruit. Greek yogurt. This is a protein. This is a pre-flavored tuna package that you could try for a little variety. Make sure you look at what's in the ingredients just so that there isn't a bunch of added sugars. I'd like to take this moment to talk about reading the label. We don't focus on total calories and calorie goals after bariatric surgery. The focus is on portion sizes and protein intake and avoiding things like added sugars. So it is a good idea to look at the label and make sure there isn't a whole bunch of added sugar, because that would really start to undermine the goals. But again, there's not really a specific calorie goal for somebody unless you've specifically been told so by your doctor or dietitian. Some other protein sources that are good in the early stages: refried beans. Again, make sure it's not real dry and sticky. Cottage cheese is a good choice. If it's kind of bland, you could spice it up. Again, things like cinnamon, salt, pepper, maybe nothing real fiery because that really might irritate your stomach. So in a typical day, you'd have 3 meals, protein with each of them, and then a fruit, a vegetable, and a starch. One of those with each meals, and you'd have 2 items with each meal. You will probably need, or you will need protein supplements, things like a protein shake, in order to start reaching your goals. So we'll move on to the next stage. My goal with this video is not to take you through each individual step in everything that you're going to be doing, but I wanted to show a range of what things would look like. So now we've jumped from week 4 up to month 4 to 6. So now the portions are going to be 2 ounces, and you'll have 2 different items. So your total meal portion will be a 4-ounce portion. And so here's a breakfast sample. We've got our protein, this is a Greek yogurt, and we've got our starch, this is oatmeal. So we've sprinkled some cinnamon on there because no calories, nice little added flavor there. If you wanted, you could add a little bit of applesauce to there, and that would give it a little, variety in the texture, and that would be fine. That was a breakfast option. 3 meals per day, of course, 2 ounces of protein with each meal, and then a starch with 1 meal, a fruit with another, and a vegetable with a third. Here's a dinner option, which has protein. This is tuna with some mayonnaise in it, and some raw vegetables. These are bell peppers. At this stage, it is okay to have raw vegetables. You need to be at least several months out from having had stomach surgery before you'd start trying raw vegetables. Things like finely chopped vegetables are going to go a little bit easier than having a big chunk of something, or just make sure you chew it really well. Here's one of my personal favorites. You can take cauliflower, put a little curry powder on it, roast it with a little bit of oil, some salt, some pepper. It's really delicious. I would not have thought so, but I tried it. Definitely recommend it. Now during this phase, most people are still going to need protein supplements in order to reach their goal, and that's fine. Just make sure that you're eating and drinking at different times. If you sit down, eat your food, and immediately take a drink, you're basically going to wash it all through and you're going to feel hungry again. We usually recommend waiting 30 minutes before and after a meal before you try to have liquids, so that way you're not washing things through. You let the food have a chance to kind of sit in your pouch and feel like you're actually full for a little bit, and that way most people don't actually feel like they're hungry all the time, even though these are small portions, and that's how this whole process works. People end up losing weight fairly quickly during this phase. Alright, we've reached the final stage. This is months 18 and out. This is the type of food that somebody is going to be eating for the rest of their life after bariatric surgery. The important thing to think about is that this is not a diet. This is not something that you're going to do for a certain amount of time and then go back to the way things were. This is the way that you want to eat for the rest of your life. These are healthy portions, healthy food choices, and this should result in long-term health. So we are now up to 4-ounce portions, 4 ounces of protein with all 3 meals, 4 ounces of a fruit, a vegetable, and a starch, 1 with each meal, and then snacks in between are okay. The snacks that we recommend would be raw fruits, raw vegetables, and those things can be had in, reasonable quantities. Here's an example of a breakfast. 4 ounces of cottage cheese and blueberries. Lots of people like to mix fruit with cottage cheese. Here could be a dinner choice. Rice, brown rice, and black beans. Now, these can be kind of bland on their own, but you can buy pre-seasoned types of beans. You can certainly season them yourself. Definitely want to avoid the kind of baked beans that have lots of brown sugar and bacon bits in them, because that really adds up to a lot of unhealthy food quickly. So I have lots of dishes to do now that I've laid all these foods out. My kitchen smells like a cornucopia of smells, but thank you for watching. Hope this was helpful for you.